students, today we will study a very interesting topic, that is variation in the shape of the RBCs. What is variation in shape of RBCs called as? It is called as poikilocytosis, whereas variation in the size is called as anisocytosis. So we will start with the first question. Yes, a 32-year-old male admitted with fever and purple spots all over the body. CBC showed hemoglobin 9.8 gram and platelet count was reduced to 84,000. CAR test was positive for which infection? Plasmodium falciparum infection. Anti-malarial drugs were started. So here is your hint, students. Anti-malarial drugs were started. So the patient was on anti-malarial drugs. Peripheral smear examination was done, and usually you would have thought that they are showing something related to the Plasmodium falciparum infection, but when you look at the RBCs, you see it is actually a variation in the shape of the RBCs. These are actually the bite cells. Why do you call them as bite cells? Let me zoom into the image. Yes, these are the bite cells. It looks as if somebody has taken a bite of an apple, right? A bite of an apple. This area looks so due to the dehemoglobinized area. So this is a case of G6PD deficiency. What are the three important causes which increases the G6PD deficiency? Yes, infections, drugs like anti-malarial and the food like fava beans. So G6PD deficiency exaggerated with anti-malarial drugs in a male, right? It is X-linked recessive, so males are much commonly affected than females, and these are the bite cells which are seen in case of G6PD deficiency. What is the other name of bite cells? These are also called as degmacytes. Nowadays, they also ask you the other name for the variation in the shape of the RBCs. Next, so I told you number 1, bite cells. These are also called as the degmacytes found in G6PD deficiency. Why do they look like this? It looks due to the dehemoglobinized area. And what are the RBC inclusions found in this case? RBC inclusions called as Heinz bodies. So let me show you the Heinz bodies. What is this stain? This is the supravital stain, unlike the normal Romanowski Gemsa stain. Now how can you differentiate between the two, students? In the supravital stain, do you see the bluish hue of the background? Bluish tinge to the background compared to the, yes, this is the bluish hinge of the background compared to the clear whitish pinkish background found in Gemsa stain. Here the RBCs are pinkish in color compared to the bluish tinge to the RBCs found in case of supravital stain. So Heinz bodies are seen or better appreciated on supravital stain. And what are these cells? These are the bite cells, also called as degmacytes. Next, spherocytes. What are the two important features you need to remember about spherocytes? Number 1, they are smaller than the surrounding RBCs. Number 1, they are smaller than the surrounding RBCs. Number 2 is they lack the central pallor. They lack the central pallor. So let me zoom into the image. They are smaller than the surrounding RBCs and they lack the typical central pallor, and these are the spherocytes. Now students, what will happen to the MCHC level? Yes, MCHC will be increased in case of spherocytes because they are smaller and they also lack the central pallor. Now they ask you what is the most common cause of the presence of spherocytes in your peripheral blood picture. Your answer will be autoimmune hemolytic anemia, not hereditary spherocytosis. Usually students get confused. As the name suggests, the most common cause of spherocytes may be hereditary spherocytosis, but no, students, the most common cause of the presence of spherocytes in your peripheral blood picture is autoimmune hemolytic anemia. Hereditary spherocytosis, also spherocytes are found, but most common cause is autoimmune hemolytic anemia. Next, can I ask you, how will you differentiate these two causes? With the help of Coombs test. Coombs test will be positive in case of autoimmune hemolytic anemia because it has a immune basis, whereas negative in hereditary spherocytosis. So Coombs test will be positive in autoimmune hemolytic anemia. It is also found in burns and ABO incompatibility. So students, spherocytes found in ABO incompatibility will disappear over a period of 1 to 2 months, unlike hereditary spherocytosis where the spherocytes will persist. Whereas in ABO incompatibility they will disappear in a period of 1 to 2 months. What will happen to Coombs test? Coombs test will be positive in autoimmune hemolytic anemia and negative in hereditary spherocytosis. What will happen to MCHC? We have already studied. They are smaller than the surrounding RBCs and they lack the central pallor. So MCHC level will be high. Next, target cells also called as codocytes, and what is the mnemonic? Very famous mnemonic, T for target cells, T for thalassemia. So target cells are found in thalassemia, also found in other hemoglobinopathies like hemoglobin C disease, hemoglobin E disease, sickle cell anemia, also found in liver disease, but most commonly they ask you T for target cells, T for thalassemia. Now why are they called as target cells? Because they look very similar to a target appearance, right? Increased hemoglobin deposition on the periphery and increased hemoglobin deposition in the center with the intervening pallor area. So these are the target cells found in thalassemia. Next, they ask you students, what is the cause of this target appearance? It is due to increased membrane deposition on the periphery. So can I say increased membrane deposition or increased surface area to volume ratio? So this is a commonly asked question. It is due to increased surface area to volume ratio. Next, schistocytes are the fragmented cells. Now, they can be found in microangiopathic hemolytic anemia or macroangiopathic hemolytic anemia. Now, microangiopathic hemolytic anemia, for example, DIC, TTP, HUS, and macroangiopathic hemolytic anemia such as cardiac valve prosthesis, but the pathogenesis remains the same. It is due to the trauma to the RBCs which will lead to lysis of RBCs. So these are the RBCs traveling, and here comes a traumatic prosthetic valve. These RBCs will come in contact with this prosthetic cardiac valve and will undergo fragmentation of the RBCs, which are called as schistocytes, Now, the shape of the schistocytes can be this typical helmet shape, which is also called as keratocyte, or it can be triangle shape. So, let me zoom into the image. Do they look just like a helmet appearance, right? These are fragmented. Do they look normal? No, these are fragmented or broken RBCs, and they are helmet shaped, called as keratocytes. Whereas here you can see these are the typical triangle shaped fragmented RBCs. Yes, causes can be micro or macroangiopathic hemolytic anemia and severe burns. Next is teardrop cells. Teardrop cells are also called as dacrocytes. Now why are they called teardrop? Because they look like a tear dropping down, Let me zoom into the image. Now do you see these teardrop cells where the tail is pointing towards different direction? This means that there is some underlying pathology. If it would have been artifact, they would have pointed in the same direction, but here they are pointing towards opposite direction. So these are the teardrop cells. Yes, found in case of bone marrow fibrosis. Very frequently asked, your fibrosed marrow. This is the fibrosed marrow, and when the RBCs are trying to squeeze through the fibrosed marrow, they attain this typical teardrop appearance while trying to pass through the fibrosed marrow. Other causes can be iron deficiency anemia, megaloblastic anemia, and the bone marrow infiltrated with hematological and non-hematological malignancies. Now, sickle cells are also called as drepanocytes. These are typical sickle or boat-shaped cells. Do you see these sickle cells? These are also called as drepanocytes. Next is acanthocytes or the spur cells. Now, what do you need to remember, students? That here the projections are present at irregular intervals and are of variable length, similar to a fat person, growing everywhere in every direction. So you can remember, in acanthocytes, also called as spur cells, they are growing in different directions, okay, placed at different intervals. These are the acanthocytes called as the spur cell. What is the common cause? A for acanthocytes, A for A beta lipoproteinemia. It is also found in macluid phenotype. Macluid blood phenotype, commonly asked question, right? So these are the important causes of acanthocytes, also called as spur cells. Next is Burr cells. Now very simple mnemonic, students. Burr cells, easy to remember. Yes, uniform and regular projections on the surface. So you can see, let me zoom the image. You can see these are uniform and regularly spaced projections on the surface of the RBCs, unlike the acanthocytes where the projections were irregular, placed at irregular intervals. Next you have to remember again a very simple mnemonic, students. Burr cells, found in case of burns, and uremia. So these are regularly placed projections, uniformly placed projections at regular intervals, Burr cells, right? Also called as echinocytes. So stomatocytes, as the name suggests, it looks as if there is a central stoma. Stoma means opening. So doesn't it look like similar to a mouth opening? These are called as stomatocytes because there is a underlying structural defect of protein, right? It is autosomal dominant condition. So topmost point, students, we will quickly revise. Bite cells, also called as degmacytes. Nowadays they are also asking the other name for the variation in the shape of the RBCs found in G6PD deficiency, and any RBC inclusion you can remember, Haynes body seen or better appreciated on the supravital stain. Spherocytes are found in autoimmune hemolytic anemia, most common cause, and hereditary spherocytosis, ABO incompatibility. Yes, T for target cells, T for thalassemia. Schistocytes or fragmented cells can be found in microangiopathic hemolytic anemia and macroangiopathic hemolytic anemia as well. Teardrop cells found in fibrosed marrow, because when they are trying to pass through the fibrosed marrow, they attain a teardrop shape. Sickle cells found in sickle cell anemia called as drepanocytes. Yes, acanthocytes found in A for acanthocytes, A for A beta lipoproteinemia. The projections are irregular and placed at irregular intervals, whereas in Burr cells they are regular and uniform projections found in burns and uremia, right students? So this is a very important table. Next is T for target cells, T for thalassemia, A for acanthocytes, A for A beta lipoproteinemia, something related with lipid metabolism defect. That means somebody is growing fat, and that means somebody is growing in irregular direction at irregular interval. Yes, acanthocytes have projections which are placed at irregular interval, whereas Burr cells placed at uniform regular projections found in burns and uremia. So with the help of these mnemonic, students, I hope this topic is clear to you.